What if the swelling in your legs is not just a normal part of getting older, but a message your body has been sending for a long time? Many adults over 60 notice the same pattern. In the morning, their feet look normal, their shoes fit, their ankles seem fine, but as the day goes on, something changes. By the afternoon, the socks leave deep marks on the skin, the shoes feel tighter, the ankles look puffy, the lower legs feel heavy, tired, and sometimes uncomfortable. And because this happens slowly, many people explain it away. They say, "I guess this is just age." They say, "My legs are not what they used to be." They say, "Everyone gets swollen ankles eventually." But I want you to be very careful with that belief, because swollen legs may be common after 60, but common does not always mean normal, and it definitely does not mean you should ignore it. My name is Dr. Amanda Collins, and in today's video, I want to explain what may actually be happening inside your legs when they swell, why this problem often gets worse with sitting, inactivity, and weaker calf muscles, and the simple movements that may help your body move fluid more effectively. Before we go any further, please understand something important. This video is for education only. Swelling in the legs can have several causes. Some are mechanical and related to circulation. Others can involve the heart, kidneys, liver, veins, lymphatic system, medications, or blood clots. So never use this video to replace medical care. If your swelling is sudden, painful, only on one side, or comes with shortness of breath, chest pain, warmth, redness, or dizziness, you need medical attention immediately. But if your swelling has been gradual, affects both legs, gets worse after long sitting, and improves when you elevate your feet, then one major system needs your attention: your calf muscle pump. Most people think the heart does all the work of circulation. And yes, your heart is responsible for pumping blood through your body. But when blood travels down into your legs, it has to come back up again. That return trip is not easy. Your feet and ankles are far below your heart. Gravity is constantly pulling fluid downward, and the blood in the lower legs needs help moving upward. That help comes from the calf muscles. Every time you walk, rise onto your toes, flex your ankles, or contract your calf muscles, those muscles squeeze the veins deep inside your legs. That squeezing action helps push blood upward toward the heart. Inside the veins are tiny one-way valves that are supposed to prevent blood from falling backward. When everything works well, blood moves up, fluid drains properly, and your legs feel lighter. But after 60, several things may begin to change. First, many people lose muscle strength in the calves. This does not always happen dramatically. You may still be able to walk, go to the store, cook, clean, and move around the house. But the calf muscles may not contract as powerfully as they used to. A weaker calf means a weaker pump. Second, many people sit for longer periods. They sit to watch television, to eat, to read, to use the phone, or to rest. And while sitting is not bad by itself, sitting still for long periods turns the calf pump almost completely off. Blood and fluid begin to settle in the lower legs. Third, the vein valves may become less efficient with age. When these valves do not close as tightly, some blood can fall backward. This creates pressure in the lower legs. That pressure can push fluid out into the surrounding tissue. That is when ankles begin to look swollen. This is why many people notice swelling later in the day. It is not random. It is the result of fluid building up hour after hour. Now, here's the good news. If the problem is partly mechanical, then movement can be part of the solution. Not random movement, not intense exercise, not painful workouts. I am talking about specific, gentle, controlled movements designed to wake up the calf pump, move the ankles, support venous return, and help the lower legs drain fluid more effectively. The first movement is called the heel-anchored ankle pump. Sit in a sturdy chair with your back supported and both feet flat on the floor. Keep your heels firmly planted. Now pull the front of your feet upward toward your shins. Do not just wiggle your toes. Pull the entire front part of the foot up until you feel the calf and shin working. Hold for 2 seconds. Then slowly release back to neutral. Do this 20 times. The key is control. Many people do ankle pumps too quickly. They flap the feet up and down and barely activate the muscle. That is not what we want. We want a full movement, a brief hold, and a full release. This movement helps activate the lower leg muscles without requiring you to stand. It is especially useful for people who sit for long periods, people who feel stiff in the ankles, or people who notice swelling after spending hours in a chair. But do not stop with this one movement. The ankle pump is only the beginning. It helps wake up the system, but the calf muscle needs more complete activation. That brings us to the second movement, which we will cover in the next part. And this one is important because it trains the calf muscle in a different way. Before moving on, comment below with the word legs if you have noticed swelling in your ankles or lower legs after sitting or standing during the day. Also tell me whether it happens in both legs or mostly one. That detail matters more than most people realize. Now that you understand why the calf muscles matter so much, let's continue with the next movement. The second movement is the seated calf raise. This may look simple, but do not underestimate it. The goal is not to burn calories. The goal is not to build large calf muscles. The goal is to squeeze the muscles that help move blood and fluid upward from the lower legs. Sit in a firm chair with your feet flat on the floor. Keep your knees bent at about a comfortable angle. Now slowly lift both heels off the floor while keeping the balls of your feet and toes touching the ground. Rise as high as you comfortably can. At the top, hold for 2 seconds. Then slowly lower your heels back down. Do 15 repetitions. The slow lowering is very important. Many people lift the heels and then drop them quickly. But when you lower slowly, the calf muscle remains engaged for longer. This creates a more controlled pumping effect. Think of it like squeezing a sponge. If you gently press and release a sponge, water moves through it. The calf works in a similar mechanical way with the veins. When the muscle contracts, it squeezes. When it relaxes, the veins refill. Repeating this action helps support circulation in the lower legs. Now, some people may ask, Dr. Amanda, can I just walk more? Walking is excellent for many people, and if your doctor has cleared you to walk, it can be one of the best habits for circulation. But here is the problem. Many older adults with swelling also have knee pain, back pain, balance problems, foot pain, or fatigue. They may not be able to walk long enough or often enough to keep the calf pump active throughout the day. That is why seated movements matter. They allow you to activate the pump even when you are not ready to go for a walk. Now let's talk about the third movement. This one surprises many people because it feels almost too gentle to be useful. But it targets something different: ankle circles. Swelling is not only about blood in the veins. Fluid can also accumulate in the tissues around the ankles. Your lymphatic system helps drain that fluid. Unlike the heart, the lymphatic system does not have one big central pump. It depends heavily on movement, muscle contraction, breathing, and changes in tissue pressure. The ankle is surrounded by small vessels and soft tissue spaces where fluid can collect. When you move the ankle in a full circle, you are not just moving the joint, you are creating gentle compression and release around the tissues of the ankle. Here is how to do it. Sit in a chair. Lift one foot slightly off the floor. Slowly draw a large circle with your foot. Move through the biggest comfortable range you can without pain. Do 10 circles in one direction, then reverse and do 10 circles in the other direction. Then switch to the other foot. The movement should be slow and smooth. Do not rush. Do not snap the ankle around. Imagine you are drawing a circle in the air with your big toe. If your ankles feel stiff, your circles may be small at first. That is okay. Start where you are. Over time, the range may improve. This movement may be especially helpful for people who feel tightness around the ankles, stiffness after sitting, or swelling that seems to sit right above the shoes. Now let me give you an example. Imagine a woman in her early 70s. Let's call her Margaret. She is not inactive. She cooks, waters her plants, walks around the house, and sometimes goes to the grocery store. but she also spends long stretches sitting during the afternoon. By 4 p.m., her ankles are swollen, her shoes leave marks, her lower legs feel heavy. She tries to reduce salt, she drinks more water, she puts her feet up at night, and those things may help a little. But every afternoon, the swelling returns. Why? Because the problem is not only what she eats or drinks, it is also that her lower leg pump is not being activated often enough during the hours when fluid is building. So instead of waiting until evening, Margaret begins doing 3 small movement sessions during the day: ankle pumps, seated calf raises, and ankle circles. Morning, early afternoon, late afternoon. After a few weeks, she notices something. The swelling has not disappeared overnight, but her legs feel lighter. Her shoes are not as tight. The sock marks are less deep. She feels more in control because she finally understands the mechanism. That is what I want for you. Not fear, but understanding. Now, before we go into the next movements, I need to make an important distinction. Not all leg swelling should be treated at home. If one leg is much more swollen than the other, especially if it is painful, warm, red, or tender in the calf, you should contact a doctor urgently. This can be a sign of a blood clot. A blood clot in the deep veins of the leg can become dangerous if it travels to the lungs. If your swelling comes with new shortness of breath, especially when lying down, waking up breathless at night, chest discomfort, or unusual fatigue, you should also seek medical care. Fluid in the legs can sometimes be related to heart problems. If the skin around your ankles is turning brown, red, thick, shiny, fragile, or developing sores that do not heal, that also needs professional evaluation. These can be signs of more advanced circulation problems. The movements in this video are not meant for emergency situations. They are meant for gradual mechanical swelling related to poor lower leg movement, venous pooling, and reduced calf pump activity. Now that this is clear, let's move to the 4th movement. This one targets an area many people forget completely: the back of the knee. When you sit with your knees bent for long periods, the area behind the knee can become a kind of traffic point for circulation. Blood and fluid from the lower leg need to pass upward through this region. If the knee stays bent and still for hours, the pathway may not move as freely. The 4th movement is the seated knee extension. Sit tall in your chair. Slowly straighten one leg in front of you until the knee is extended. You do not need to lock it painfully, just straighten it comfortably. Hold for 2 seconds, then slowly lower it back down. Do 10 repetitions on one side, then 10 on the other. As you extend the leg, you may feel a gentle stretch behind the knee or in the back of the thigh. That is normal as long as it is not painful. This movement helps create motion through the knee area and supports the pathway from the calf toward the upper leg. The first 4 movements can all be done sitting down. That is very important because many people with swollen legs are older adults who may also have balance concerns, arthritis, dizziness, or weakness. But now we are going to talk about the strongest calf pump movement in this routine, the standing heel raise. This movement is powerful because your calf muscles have to work against your body weight. When done correctly, it creates a stronger contraction than the seated version. Here's how to do it safely. Stand behind a sturdy chair, kitchen counter, or stable surface. Place both hands lightly on the support. Your feet should be about hip-width apart. Keep your toes pointing forward. Now slowly rise onto the balls of your feet, lifting both heels off the floor. Go as high as you comfortably can. Hold at the top for 2 seconds, then lower your heels slowly back down over 2 to 3 seconds. Do 10 to 15 repetitions. Do not bounce, do not rush. Do not let your heels slam down. The slow lowering is part of the benefit. If you feel unsteady, start with fewer repetitions. You can also do the movement with a chair behind you or near a wall. Safety comes first. If you have severe balance problems, dizziness, recent falls, or have been told not to do standing exercises, ask your doctor or physical therapist before trying this. Now, why does this movement matter so much? Because the calf muscle was designed to work during weight-bearing activity. Walking, climbing stairs, rising onto the toes, pushing off the ground, these actions create a strong pumping effect. But modern life has reduced how often many people use this system. Many older adults sit for meals, sit for television, sit in the car, sit in waiting rooms, sit while using the phone, and sit when tired. Again, sitting is not the enemy. The problem is sitting without interruptions. Your legs need movement breaks. That brings us to one of the most important ideas in this entire script. Timing matters. Most people try to fix swelling after it has already become obvious. They look down at 7 p.m., see swollen ankles, and then decide to elevate their feet or move a little. That may help temporarily, but by that point the fluid has been building all day. It is much easier to prevent fluid from accumulating than to remove a large amount once it is already there. So here is a practical routine. First session, morning. Within the first hour after waking, do the full routine. Ankle pumps, seated calf raises, ankle circles, seated knee extensions, and standing heel raises if safe for you. This wakes up the circulation early, while the legs are usually at their least swollen. Second session, early afternoon. Do the routine again around the time you usually sit the longest, or before swelling normally begins. For many people, this is between noon and 2 p.m. This session is important because it interrupts the buildup. Third session, late afternoon. Do another shorter session around 4 or 5 p.m. before the evening swelling becomes severe. You do not have to do everything perfectly. Even a few minutes of consistent movement can be better than sitting still for hours. If 3 sessions feel like too much, start with 2, morning and afternoon. The best routine is the one you will actually do consistently. Now let's put the full routine together. Movement 1, heel-anchored ankle pumps, 20 repetitions. Movement 2, seated calf raises, 15 repetitions. Movement 3, ankle circles, 10 circles each direction on each foot. Movement 4, seated knee extensions, 10 repetitions each leg. Movement 5, standing heel raises, 10 to 15 repetitions, only if safe. This should take about 8 to 12 minutes depending on your pace. You can do it while watching television, before lunch, after breakfast, or during breaks in your day. Now I want to explain something that many people misunderstand. These movements are not a magic cure. If your swelling is caused by serious heart disease, kidney disease, liver disease, blood clots, infection, medication side effects, or advanced vein disease, exercises alone will not solve the underlying issue. You need proper evaluation. But if your swelling is strongly connected to inactivity, sitting, weak calf activation, and mild venous pooling, then these movements may help support your body's natural drainage system. And even if you already use compression stockings, movement still matters. Compression stockings may help support the veins from the outside. They can be very useful for some people, but they do not replace the calf pump. Your body still needs muscle contraction. In many cases, compression plus movement may be more effective than relying on compression alone. Now let's talk about common mistakes. Mistake number 1, doing the movements too fast. Fast movements often become sloppy movements. You need slow, controlled contractions. Mistake number 2, only doing them at night. Nighttime movement may help, but the real strategy is to interrupt swelling before it peaks. Mistake number 3, ignoring one-sided swelling. If one leg is suddenly more swollen than the other, do not assume it is the same issue. That needs medical attention. Mistake number 4, expecting overnight results. Some people feel lighter legs quickly. Others need several weeks of consistency. Your veins, muscles, and tissues may have been struggling for years. Give your body time. Mistake number 5, staying seated for hours without breaks. Even if you do the routine, try to avoid long, uninterrupted sitting. If possible, stand up briefly every 30 to 60 minutes. Walk around the room, do a few heel raises, move your ankles. Small breaks can make a big difference over time. When do your legs swell most? Morning, afternoon, or evening? Does it happen after standing, after sitting, or both? Does elevation help? Do both legs swell, or only one? These answers can help you explain the issue more clearly to your doctor. Before we finish, I want to slow down and talk about safety, because leg swelling is one of those symptoms that can be simple, but it can also be serious, and the difference matters. Many people spend years trying home remedies without ever asking the right medical questions. They reduce salt, they drink more water, they buy bigger shoes, they elevate their feet, they use creams, they massage the ankles. Some of these things may bring temporary relief, but none of them answer the most important question: why is the swelling happening? There are several possible causes. It may be venous insufficiency, where the veins in the legs have trouble sending blood back upward. It may be reduced calf pump activity from sitting too much or losing muscle strength. It may be lymphatic congestion, where fluid does not drain efficiently through the tissues. It may be related to medications. Some blood pressure medications, anti-inflammatory drugs, diabetes medications, and hormone-related treatments can contribute to swelling in some people. It may also be related to the heart, kidneys, liver, thyroid, nutrition status, or other medical conditions. This is why I never want you to see swelling as something to panic about, but I also do not want you to dismiss it. Here are warning signs that need medical attention. Number 1, swelling in only one leg. If one leg suddenly becomes more swollen than the other, especially if there is pain, warmth, redness, tenderness in the calf, or a deep cramping sensation, do not treat it like ordinary swelling. This can be a sign of a blood clot. You need urgent medical evaluation. Number 2, swelling with shortness of breath. If your legs are swelling and you also feel breathless, especially when lying flat, walking short distances, or waking up at night gasping for air, talk to a doctor promptly. This can sometimes be connected to heart failure or fluid overload. Number 3, swelling with chest pain, fainting, confusion, or severe weakness. These symptoms should never be ignored. Number 4, skin changes. If the skin around your ankles or lower legs becomes dark brown, reddish, shiny, thick, tight, scaly, or starts forming sores that may indicate more advanced circulation or tissue problems, this deserves professional evaluation. Number 5, sudden swelling after surgery, long travel, injury, or being immobilized. These situations can increase clot risk, so do not wait. Now, if you do see a doctor, here are some useful questions to ask. Ask, could my swelling be related to venous insufficiency? Ask, should we check my heart, kidneys, or medications as possible causes? Ask, would a venous ultrasound be appropriate for me? Ask, could any of my medications be contributing to this swelling? Ask, would compression stockings help in my case, and what strength would be safe? Ask, would physical therapy or a vascular specialist be appropriate? These questions help move the conversation from "my legs are swollen" to "what is the cause and what is the best plan?" Now let's review the 5 movements one more time. The heel-anchored ankle pump helps activate the lower leg while seated. The seated calf raise strengthens the pumping action of the calf. The ankle circles support ankle mobility and gentle fluid movement around the joint. The seated knee extension moves the area behind the knee and helps prevent stiffness from long sitting. The standing heel raise creates the strongest calf contraction, but should only be done if your balance and medical condition allow it. The routine is simple, but the consistency is what matters. Do it in the morning to wake up the system. Do it early in the afternoon before swelling peaks. Do it again later if your legs usually become heavy by evening. And remember, you do not have to be perfect. You just have to start. Many people over 60 feel discouraged because they believe their body is only declining. But sometimes the body is not asking for something complicated. Sometimes it is asking for the right movement at the right time, repeated consistently. Your legs were designed to move. Your calves were designed to pump. Your ankles were designed to flex, rotate, and support circulation. When these systems go quiet, fluid can accumulate. When they wake up again, many people begin to feel a difference. Maybe not overnight, maybe not dramatically in one day, but gradually, with attention and consistency. And I want you to hear this clearly. You are not helpless just because you are older. Aging changes the body, yes, but not every change should be accepted without question. Swollen legs may be a sign that something needs attention. And in many cases, the first step is not fear, it is awareness. So today, choose one small action. Do the ankle pumps after this video. Try the seated calf raises before your next meal. Move your ankles while watching television. Stand safely behind a chair and do a few heel raises if you are able. And most importantly, pay attention to your body's pattern. If this video helped you understand your legs in a new way, please like this video, subscribe to the channel, and share it with someone over 60 who has been blaming swollen ankles on age alone. Also, leave a comment below and tell me which movement you are going to try first. Is it the ankle pump, the seated calf raise, the ankle circles, the knee extension, or the standing heel raise? And if your swelling is only on one side, painful, sudden, or comes with shortness of breath, please do not wait. Speak with a medical professional. In the next video, I will explain the silent signs in the feet and lower legs that may reveal circulation problems earlier than most people realize. These signs are often ignored because they look small at first, but they can tell an important story about what is happening inside your blood vessels. I am Dr. Amanda Collins. Take care of your legs, listen to your body, and I will see you in the next video.